Welcome back to the Dr. Ridwan Show. This episode is on erectile dysfunction. And we learned about the non-surgical treatment of erectile dysfunction. So when medical or non-surgical treatments of erectile dysfunctions don't work, is that the end of the sex life of the patient or the man with ED, or are there other treatments? Dr. Carson.
No, there's certainly other treatments, and the surgical treatment of erectile dysfunction is not something we start with because it's the most invasive, but it certainly has the best satisfaction rates and it has the best outcomes for many patients. And surgical treatment of erectile dysfunction consists predominantly of a penile implant or penile prosthesis.
The word penile implant and penile prosthesis is the same thing because our patients hear both penile implant and penile prosthesis. Is that so?
It's very much the same thing, exactly the same operation, the same procedure.
So what is exactly a penile implant?
Well, penile implants have been around since the 1970s, so there's nothing new about them. And what they consist of are two cylinders that go into the erectile bodies of the penis. And those cylinders can be called semi-rigid, so they can be solid, so that the erection is there all the time. And that was kind of the first kind of implant that was done. That's been supplanted by more physiologic, more normal kind of implants that we use today in 2010. The implants themselves are, today, the inflatable implant is the predominant one. We actually did a series, an investigation some years ago looking at the patients in the Southeast, and 95% of them had the inflatable penile implant, which is the other kind of implant. Inflatable implants consist of two cylinders that, again, go into the two erectile bodies of the penis. And you have to have two because there are two erectile bodies in the human penis. And those are measured at the time of surgery to the length of the patient's penis on the inside. And they're hollow and connected to these two cylinders is a small pump device that goes down into the scrotum or the sac. It's like having a third testicle, so we don't have to remove anything. We put this small pump device into the scrotum. Patients can feel that through the skin, so they can feel the parts of it, and that allows the device to be activated, to be inflated, to make it hard, to be deflated, to make it soft.
So the implant is inside the body. That means if the man with a penile implant walks naked, nobody would see anything, right?
Totally implanted, totally out of sight. Patients can shower in public. They can shower at the health club. They can wear any kind of clothes. They can go through the airport and nobody would know that they have it. We have patients that ride horseback, that ride motorcycles, that do all kinds of physical activities of all sorts, and has no impact on their implant.
When you speak about implants, you remind me in our modern medical science of other implants. I mean, implants nowadays are the miracles of medicine. You speak about a pacemaker, a defibrillator. Those are devices that are implanted in the heart to prevent an irregular heartbeat and save life. You speak about heart valves, which Dr. Mosak knows, in heart surgery, and Dr. Rybakov, that those are implanted in the heart to function as a valve. There are knee implants, knee joint implants, hip joint implants, islands. So there are a lot of implants. Where do penile implants fit in the big world of implants in modern medicine? How do they compare? Do they have good mechanical reliability, good longevity, long-term satisfaction?
Yeah, the outcomes are exceptional. In fact, of all of the implants that you've mentioned, actually the penile implants have more reliability than almost any of those. And they last at least 12 to 15 years, we think, and they can be replaced and repaired if there's a problem with them down the road. They certainly provide excellent function for the patients, and indeed the satisfaction rates are well over 90% in most studies, both for patients and their partners. So it's something that's very well accepted, very reliable, has low morbidity and low complication rates, but also provides a very good function for the patient.
Now, you happen to be, Dr. Carson, one of the authors, and actually the lead author of the paper on the long-term outcomes of penile implants. This scientific paper was done on a study that was multi-center study in multiple centers, not only your center. What did that study show?
Yeah, that study that was published about 10 years ago now involves 7 centers that implanted a large number of penile implants. And what we were trying to find out is that after the patient had had their implant for somewhere between 5 and 10 years, was the implant still working? Did they still like it? And most importantly, did they still use it? And indeed, we found out that the vast majority of the implants were still functioning at 5 to 10 years. More than 80% were functioning at 5 to 10 years. The majority of patients still liked their implant. In fact, 85 to 90% of patients were very satisfied with their penile implant. And the most gratifying thing was that even patients that had had their implants for as much as 10 years used their devices four or more times a month. So they liked them, they worked, and they used them. And that's the ultimate test of an implant.
Now, I have been doing penile implants for a long time since I finished my fellowship at Baylor College of Medicine and then moved to New York. And we see that a lot of our patients with penile implants nowadays not only failed medical treatment, but they also, many of them have diabetes, many of them are after radical prostatectomy or radiation therapy of prostate cancer. Is this also your experience?
Yes, we're seeing more and more patients for penile implants that have had radical prostatectomy. Some years ago, before the Viagra days, most of our patients were diabetics, and we did a lot younger patients. The population is shifting to more radical prostatectomy patients, although we still do diabetics, still do patients with significant vascular disease. Really, one of the most gratifying parts of the penile implant developments is the new development of antibiotic-coated penile implants.
And why coat the implant with antibiotics?
With any implant, one of the things that one worries the most about is infection. Infection is the most disastrous complication that can happen, whether it's a knee or a hip or a penile implant. And so eliminating or reducing the number of patients with infection is a very important task.
So infection is an important complication of not only penile implants, any implant, and the antibiotic coating reduces that.
It's the most tragic, difficult complication to deal with. And with the antibiotic coating that we currently are using today, it's reduced the infection risk from somewhere around 5% to really around 1%, which is a significant decrease in infection risk. And in fact, the data were so good that the FDA has actually agreed that this is an excellent way of reducing infections with penile implants.
Indeed. Very interesting information. Now, what many of our patients ask us about the penile implant and what's involved in the recovery and how much time lost. So I tell the patient the rule of 4 wins: 1 hour, 1 day, 1 week, 1 month. So we tell the patient the surgery itself is 1 hour, the hospital stay is 1 day, out of work 1 week, and no sex 1 month. Is that something you do also in North Carolina?
That's a very good rule of thumb. I think one of the other issues is when do the implants work well? And they work well starting at 1 month, but they work better as time goes on. And there's a break-in procedure, break-in time. So really the best function is around 3 to 6 months on. But patients can often begin using their implant at about 4 weeks after the surgical procedure.
Thank you very much, Dr. Carson. When medical therapy doesn't work, surgical treatment with penile implants can be very successful with long-term satisfactory outcomes and low complication rates. Men who have erectile dysfunction and do not respond to medical treatment such as the pills and injections should speak to their doctors. Speak to your doctor, ask for a referral to a urologist because penile implants can be very satisfactory to treat erectile dysfunction when medical therapy does not work. Once again, stay with us on the Dr. Ridwan Show, and we will be coming soon in the next segment with a real story on erectile dysfunction.